once they get the injection.
October is Breast Cancer Awareness Month, and you have probably heard a lot of reminders in the last few weeks about the importance of regular screenings. But do you really know how high your risk is? I recently spoke to an oncologist with our partners at Boulder Community Health. Dr. Jenny Fox says our health is not something we can take for granted.
How likely is a woman to be diagnosed with breast cancer?
Well, it's actually very common, unfortunately. So breast cancer is the most common cancer that a woman would be diagnosed with in the United States. And so most of us have heard the number 1 in 8 women in her lifetime will have breast cancer. So that's about 12%. So quite common, unfortunately.
Yeah, and it means that most women probably know someone, too, who's gone through that.
That's usually the case.
As well. So is family history still one of the biggest factors that leads to breast cancer?
Well, it's a really important risk factor if it is there, but I think one misconception is that if you don't have a family history, that you're not at risk. So the vast majority of women who have breast cancer, about 85%, don't have a family history. So if we limit screening just to women who have a family history, we're really missing the majority of women. Screening remains very important, trying to find breast cancers early when they're the most treatable, the most curable, and really screening mammogram is the best way to do that. And so we still recommend that women start having annual mammogram starting at age 40. And there's a new technology available, so digital mammogram is really what we've been using for a number of years. 3D mammogram, breast tomosynthesis, is a new technology that is pretty widely available now that really gives us some great pictures, and so takes some additional views of the breast. And what we're hoping, and what we've seen so far, is that detecting breast cancers even earlier, picking up more breast cancers, and hopefully avoiding some of those false positives where women get a call back, creates a lot of anxiety, might need a biopsy, those kinds of things.
And remember, if you do have a family history of breast cancer, talk to your doctor about starting those mammograms even before you turn 40.